Have you ever considered what you would do if a stroke occurred and you found yourself completely alone? For older adults, this scenario can seem particularly frightening. But what if I shared with you that there are effective, straightforward measures you can implement right away, even when nobody else is present, to enhance your survival odds? This video is specifically designed for you, the over 60 community who might encounter this terrifying circumstance by yourself. We'll explore 5 crucial, life-preserving strategies that every senior should understand to survive a stroke when assistance isn't immediately available. No unnecessary details, just clear, actionable guidance created to enable you to respond quickly and protect your own life. Stay with us, because what you discover here could genuinely save your life. And I assure you it's more memorable than you might expect. Let's dive straight in. Strategy 1. Identifying the warning signs and responding immediately. When it comes to surviving a stroke or cardiac event, the very first factor that can determine your outcome is identifying the warning symptoms and responding without any delay. You see, timing is absolutely essential because every second that goes by without medical intervention, your brain and cardiac tissue face the risk of permanent damage. Many older adults hesitate or dismiss minor symptoms, assuming it's merely heartburn or tiredness. But that hesitation can waste valuable minutes or even hours. For instance, think about James, a 73-year-old former educator who experienced a sudden loss of sensation in his face and weakness in one arm while reading his morning newspaper. Rather than dismissing it, he immediately contacted emergency services and applied the straightforward method we'll explore next. That swift response made all the difference. He received early treatment and achieved an outstanding recovery. The reason identifying symptoms early is so vital stems from how strokes and cardiac events develop. A stroke may begin with sudden mental confusion, speaking difficulties, or problems understanding language, along with numbness or weakness, especially on one side of the body. A cardiac event frequently starts with chest discomfort, difficulty breathing, cold perspiration, or even sudden lightheadedness. Unfortunately, many seniors dismiss these symptoms or feel uncomfortable seeking help, worrying they might inconvenience someone or overreact. But here's the reality. Responding quickly saves lives, and it's never an inconvenience to seek immediate medical attention. From a psychological perspective, fear and denial can impair decision-making during these critical moments. It's human nature to wish symptoms will disappear. But that wishful thinking can be fatal if it prevents calling emergency services. Learning to trust your body and react decisively is a form of self-respect and self-care, enabling you to take charge even when alone. It's a perspective change that can dramatically alter outcomes. So, the first life-preserving strategy is to thoroughly educate yourself about the symptoms of stroke and cardiac events and mentally prepare yourself to respond immediately. Don't dismiss your body's warnings or worry about creating a disturbance. Respond with urgency and confidence. Keep emergency contact numbers easily accessible, and if feasible, consider wearing a medical alert device that can quickly summon assistance. This proactive strategy isn't just about information, it's about adopting a survival mentality, especially crucial for seniors who may face these events alone. Remember, the difference between seeking help at the first symptom or waiting can be measured in the quality and duration of your life. Strategy 2. The effectiveness of self-help methods when alone. When you find yourself isolated during a stroke or cardiac event, the feeling of being alone can seem overwhelming. But it's essential to remember that you are not helpless. There are practical life-saving methods you can implement immediately to protect your heart and brain while awaiting emergency responders. One of the most crucial is the self-administered cough CPR technique, which can help maintain blood circulation and oxygen flow, providing vital time. Let me tell you about Helen, a 78-year-old grandmother who lived independently and experienced a sudden cardiac event one afternoon. She recalled learning about the cough CPR technique from a health presentation and immediately began coughing forcefully every few seconds while calling 911. Her consistent action helped keep her alert and stable until help arrived. Cough CPR functions because coughing compels the heart to circulate blood, preventing it from stopping entirely, which is especially critical in those initial minutes when every heartbeat matters. This technique isn't commonly known or taught in standard medical guidance, but for seniors living independently, it can mean the difference between survival and death. Additionally, simple breathing exercises designed to enhance oxygen intake can further support the body during a crisis. Deep, slow breaths can reduce panic and improve oxygen levels, essential when the heart is under stress. Understanding and implementing these self-help methods requires a combination of knowledge and mental readiness. Many seniors hesitate because they're concerned about doing something wrong or making their condition worse. But the danger of doing nothing far exceeds the risk of trying. In fact, training yourself mentally and physically to respond with these techniques can build confidence and decrease fear in emergencies. Practicing them regularly, even without a crisis, can help them become automatic responses. Helen's experience serves as a powerful illustration. When her heart began racing and chest pain started, panic could have overwhelmed her. But instead, she remained calm and used what she knew. She continued coughing firmly and steadily, and even managed to reach her phone to call for help. This steady determination kept her conscious and breathing, providing her body with precious support until paramedics arrived and took control. So, the second life-preserving strategy is to arm yourself with practical self-help techniques and prepare mentally to use them confidently. It's not about becoming a medical professional, but about being proactive and ready to take simple actions that protect your life. This preparation can significantly increase your chances of survival and recovery. If you're still watching this video and finding these insights valuable, please comment Strategy 2 below to let me know you're here. And if you haven't subscribed yet, I recommend you subscribe and turn on notifications so you don't miss any videos. Your support helps us continue creating valuable material to inform and inspire you. Now, let's continue forward. Strategy 3. The essential role of recognizing early warning signals. One of the greatest obstacles seniors face during a cardiac event or stroke, when alone, is recognizing the early warning signals quickly and accurately. Many dismiss subtle symptoms, attributing them to age or other ongoing conditions. But this delay can be fatal. Knowing what to watch for and trusting your instincts can be the difference between immediate action and tragic delay. Let me tell you about Carl, a 75-year-old retired educator who felt a mild but unusual discomfort in his chest one quiet morning. Instead of dismissing it, Carl remembered the importance of listening to his body and decided to act quickly. Early warning signals of a cardiac event often include chest pressure, difficulty breathing, sudden weakness, cold perspiration, or nausea. Strokes might begin with sudden numbness or weakness in the face, arm, or leg, especially on one side of the body, confusion, difficulty speaking, or severe headache. These symptoms might be brief or mild initially, but ignoring them is dangerous. Carl felt mild chest tightness and a bit of dizziness, but didn't panic. He immediately sat down, focused on steady breathing, and reached for his phone to call emergency services. Recognizing these signals isn't just about physical symptoms, but also understanding what's normal for you and what isn't. Many seniors live with chronic ailments that can mask or confuse these warning signals. This is why education and awareness are so vital. Carl's prior education through health workshops and his regular conversations with his doctor empowered him to take swift, decisive action when the symptoms appeared. This awareness likely saved his life. Psychologically, understanding early symptoms helps reduce denial and fear, common responses that cause hesitation. When you can identify what's happening, you can move from confusion to action. Carl's confidence in recognizing danger allowed him to overcome fear and reach out for help immediately, despite being alone. This emotional readiness complements physical preparedness and can drastically improve outcomes. It's also crucial to share this knowledge with friends, family, and caregivers. The more people around you who know the signs, the better the chance someone will notice if you can't call for help yourself. But ultimately, the responsibility starts with you. Regular health checkups, discussions with your doctor about your risk factors, and keeping a symptom journal can deepen your understanding of your body's signals. Another aspect of this pillar is the importance of immediate response. Once you notice these warning signals, don't hesitate or second-guess yourself. Call 911 immediately and describe your symptoms clearly. Paramedics can start life-saving treatment on the way to the hospital. Carl did exactly this. He didn't wait for the symptoms to worsen or disappear. He called for help at the first sign, leading to quick intervention and a full recovery. Seniors often worry about being a burden or overreacting. But when it comes to strokes or cardiac events, every minute counts. Carl's story teaches us that taking action early, even if it feels inconvenient or embarrassing, is vital. Your life is worth any temporary discomfort or worry. So, the third life-preserving strategy is to educate yourself thoroughly on the early warning signals of stroke and cardiac events, and to trust those instincts to act fast. This knowledge and confidence are your first line of defense in protecting your life when you are alone. Strategy 4. The life-preserving power of proper positioning and breathing methods. When a cardiac event or stroke occurs and you're alone, the way you position your body and control your breathing can dramatically influence your chances of survival. It's not just about waiting for help to arrive. Your immediate actions can ease symptoms, improve oxygen flow, and reduce stress on your heart and brain. This is why knowing how to position yourself properly and use breathing methods is essential knowledge for every senior. Let me share with you the experience of Helen, a 78-year-old woman who suffered a mild stroke at home while alone. She felt sudden weakness on one side and was frightened, but she remembered advice from a community health seminar. Helen sat down, leaned slightly forward, resting her elbows on her knees, and took slow, deliberate breaths. This simple adjustment helped her breathe easier, reduced dizziness, and allowed her to stay calm until paramedics arrived. Proper positioning during a cardiac or stroke emergency can help manage symptoms and prevent complications. For instance, sitting upright or slightly forward can relieve pressure on the lungs and heart, making it easier to breathe and reducing the strain on the heart muscle. Lying flat might worsen symptoms like shortness of breath. If you feel dizzy or lightheaded, try to sit or lie down to prevent falls, but avoid lying flat on your back unless absolutely necessary. Breathing plays a crucial role in maintaining oxygen levels and calming your nervous system. Deep, slow breaths can help reduce panic and lower heart rate, which is vital because panic can increase blood pressure and oxygen demand, worsening the situation. Helen used a technique of inhaling slowly through her nose, holding her breath for a few seconds, and then exhaling gently through pursed lips. This method helped her stay composed and maintain better oxygen intake during her emergency. The psychological benefit of these techniques cannot be overstated. Fear and panic are common during emergencies, and they can lead to poor decisions or physical exhaustion. By focusing on body positioning and controlled breathing, you create a sense of control and calm, which improves your ability to think clearly and act decisively. Seniors who are prepared with this knowledge and practice these techniques regularly are better equipped to face emergencies. Practicing breathing exercises daily can build muscle memory, so in moments of crisis, it becomes second nature. Helen's story is a perfect example of how simple but effective strategies can make a life-saving difference. Additionally, having a phone within reach, ideally with emergency numbers pre-programmed, is essential. Combining proper positioning and breathing with prompt communication can dramatically improve outcomes. Helen was able to call 911 while maintaining calm, which allowed paramedics to arrive quickly and provide treatment. Remember, these strategies are not substitutes for medical care, but crucial first steps to support your body when immediate help is not available. The right posture and breathing techniques help buy precious time, reduce complications, and increase the chances of survival. Taking these steps can make all the difference. It's about empowering yourself with practical tools to manage your health even in the toughest moments. If you're still watching this video and finding these insights valuable, please comment Strategy 4 below to let me know you're here. And if you haven't subscribed yet, I recommend you subscribe and turn on notifications so you don't miss any videos. Your support helps us continue creating valuable material to inform and inspire you. Now, let's continue forward. Strategy 5. The critical importance of recognizing early warning signals and acting fast. When facing a cardiac event or stroke alone, time isn't just money, it's survival. Recognizing early warning signals and acting immediately can be the difference between life and death, and between full recovery or lasting damage. This is especially true for seniors, whose symptoms might sometimes be subtle or mistaken for less serious issues. Let me tell you about Robert, a 72-year-old man who experienced unusual fatigue and mild chest discomfort one morning while he was home alone. Instead of brushing it off, Robert remembered the importance of early recognition and called emergency services right away. Because he acted quickly, doctors were able to administer treatment that minimized heart damage and saved his life. His story shows the power of knowing what to look for and not hesitating to seek help. Early warning signals of a cardiac event often include chest pain or pressure, shortness of breath, nausea, lightheadedness, and pain radiating to the arms, neck, or jaw. For strokes, common signs are sudden numbness or weakness in the face, arm, or leg, especially on one side. Confusion, trouble speaking or understanding speech, difficulty seeing in one or both eyes, trouble walking, dizziness, and loss of balance or coordination. These symptoms can appear suddenly or develop gradually, but they are always urgent. The challenge is that seniors may sometimes dismiss these symptoms as normal signs of aging, or attribute them to less dangerous conditions like indigestion or fatigue. This mindset can be deadly. Recognizing that these symptoms require immediate medical attention can literally save your life or reduce the severity of long-term effects. One of the reasons early recognition is so vital is because treatments like clot-busting drugs or emergency surgery are most effective when administered quickly, often within the first few hours of symptom onset. Every minute counts. Delaying medical care increases the risk of permanent heart or brain damage, disability, or death. Moreover, seniors living alone must have a clear plan to act when symptoms arise. This includes having emergency phone numbers accessible, knowing how to describe symptoms clearly to dispatchers, and even having neighbors or friends alerted if possible. Being proactive can speed up the response time and improve outcomes. Psychologically, fear and denial often delay action. You might feel embarrassed or reluctant to call for help, thinking the symptoms will pass, or that you don't want to trouble anyone. But these feelings can put your health at great risk. Accepting that asking for help is a strength, not a weakness, is crucial for survival. Training yourself and your loved ones to recognize these warning signals can make a big difference. Educational programs, regular health checkups, and open conversations about symptoms and emergencies empower you to take control when it matters most. Robert's experience is a clear reminder. Knowing the signs and responding immediately can protect your health and extend your life. It's not just about avoiding panic, but about understanding what your body's telling you and acting swiftly. Prepare yourself to act decisively and without delay. This knowledge is your best defense against the unexpected. Now that we've explored these life-preserving strategies, it's clear just how crucial it is to be prepared, especially when facing a cardiac event or stroke alone after 60. None of us wants to imagine being in such a vulnerable situation, but the reality is that it can happen to anyone. That's why knowing what to do immediately, Recognizing symptoms, staying calm, calling for help, and using what's around you is not just important, it's essential. You might be thinking, I'm healthy, I don't need to worry about this, or I have family around me so I'll be fine. While that hope is natural, life often throws unexpected challenges. Sometimes help isn't right there when you need it most. Preparing yourself with knowledge and practical steps is the best way to protect your independence and your life. Please take a moment now to share what you've learned. Leave a comment below telling us which strategy resonated most with you and how you plan to use this knowledge in your daily life. Your experiences and thoughts are important to us and help build a supportive community where seniors empower each other. If this video helped you, please like, subscribe, and share it with others who might benefit. Your support motivates us to continue creating content that informs, uplifts, and inspires. Together, we can face these challenges with courage and confidence. Thank you for joining us today. Stay safe, stay informed, and remember, you have the power to protect your life, even in the toughest moments. We look forward to seeing you in the next video.